When bacteria accumulate around a tooth, they'll adhere to the tooth, and the bacteria can set up decay, but they can also set up gum infection. The bacteria themselves put out all sorts of toxic substances that cause the gums to become inflamed. Over time, though, the bacteria can calcify and become hardened, and that's called tartar or calculus. Calculus is very rough, so bacteria have an easier place to hide once a little bit of tartar begins to form. So initially it takes a while for tartar to build up, but once it does, more and more bacteria adhere to it, and then they calcify, and it just snowballs. If a person does not have the tartar removed, then the condition could become quite severe, because the bacteria then would inflame not just the gums, but also the underlying bone. Tartar should be removed professionally. There's an art to locating it, especially the tartar beneath the gum, and it's not something that you can do at home. I'm going to switch back to this model. Again, this is the one that the bone has been removed from the front part of the jaw to expose the roots of the teeth, and the tooth that you see here has the front part of it removed so you can see the interior of the tooth. A tooth is held into the surrounding bone by a little ligament that runs from the bone to the root of the tooth. So right where my pencil is, all the way around, there's a very, very tiny ligament. If bacteria get beneath the surface of the gum and get down far enough to where that ligament begins, the ligament will become infected and will begin to deteriorate. The tooth now might begin to loosen. As more and more destruction occurs, not only does the ligament deteriorate, but the bone itself that's holding the tooth into position will also deteriorate. That condition is known as periodontal disease. And if it is mild with just a minimum amount of loss, it might be treated by a deep cleaning. But if it's very severe, then it might require surgical intervention, in which case the diseased areas would be removed, and if possible, bone replacements would be done to stabilize the root.